Hi guys, I'm Dr. Shivangi, a family physician.
Dr. Pratibha, gynecologist.
And today's video, I want to talk about the flu vaccination and not COVID, even though it's on the rise. Of late, we are seeing a lot of respiratory cases, and that is mostly attributed to the influenza A and influenza B infection. So, this is why it is becoming even more important to take the annual influenza vaccine. So, when do you take it? It should be taken between the months of October to November, prior to the peak influenza season that happens between Jan to March. Okay, so you should have a gap of 2 to 4 weeks for your antibodies to develop. And the reason why we should take it is because it can prevent the development of the influenza infection in over 70% of the vaccinated population, and it obviously helps in preventing it from becoming very severe, leading to hospitalization. The important thing to remember though is to not take this vaccine, or any vaccine for that matter, when you're having an active infection. You should wait for 4 to 6 weeks after the infection has fully settled and then take the vaccine. So Ma, please tell us about what are the general precautions for any respiratory illness.
First thing to remember is to wear a mask when we are going in a crowded places or we are traveling. Maintain a good hand hygiene, washing your hands when you come back, or use sanitizer if you cannot wash your hands. Maintaining a social distance, and the people who are immunocompromised or asthmatic, pregnant, or with having any other diabetics, any other severe disease should avoid going to such places.
High-risk people. Yeah.
High-risk people, to avoid going to such places unless it is absolutely necessary.
So another important thing to note that I wanted to tell you, especially because COVID cases are rising, is that the flu vaccine also provides some amount of cross protection, for the COVID infection. And there are some reports regarding this. So it is, even more imperative to get the flu vaccine even today, if you haven't gotten it yet, and make sure to continue this yearly, because this vaccine comes up annually depending upon the strain that is the most prevalent in that year. So make sure you get your annual influenza vaccine, and get it today if you haven't already. Thank you.
Thank you.